On March 11, 2020, the World Health Organization declared the COVID-19 outbreak as a global pandemic. It had spread across 6 continents, taken innumerable lives, crashed economies, ruined the entire sports calendar, and pretty much wrecked the whole world. What exactly is COVID-19? Severe acute respiratory syndrome coronavirus 2 or novel coronavirus or nCoV-19 is a disease which is caused by a virus. These viruses appear in the shape of a crown with protein spikes jutting out and genetic material inside them. In Latin, the word corona means crown, hence the name. This virus is usually found in animals but has been transmitted to humans from an exotic animal market in Hubei province of China. This phenomenon in which a virus gets transmitted from animals to humans is called as a spillover. Since the spillover occurred in China, the disease has spread at a remarkably fast pace, infecting countries with advanced medical facilities such as Italy, Spain, and the United States. The usual symptoms of this disease are cough, sore throat, headache, fever, possible body aches, and the newest one is loss of taste and smell. In severe cases of COVID, there is pneumonia as well. There are 2 types of tests for COVID-19, antibody testing and testing for the virus itself. The first technique is not that efficient as it takes almost 8 to 9 days for the body's immune system to develop antibodies against the virus. There are 2 ways to test for the virus itself, the PCR or the polymerase chain reaction test and the NAT or the nucleic acid amplification test. On the statistical side, the extent of the spread of the virus can be found using a metric known as the R0 or the R factor. The R0 is the basic reproductive rate of the virus, which indicates how many people will be affected by one infected person. The R0 of COVID-19 on average is 2.5. If we take this metric as the common ratio in a geometric progression, we can simulate a situation. 2 infected people can infect 5 others, who can infect around 15 others, and so on. If the first 2 people are not identified, quarantined, isolated, they can infect 5 others again, thus starting a new chain all over. This is why social distancing is an essential step to be taken. This is the graph of the spread of the virus, also known as a contagion curve. If effective hygienic methods are practiced, then this slope can be reduced. This essentially means that the virus would spread in a slow and controlled way, well within the capacity of the current healthcare systems. The end of the pandemic depends on the start of the pandemic as well, so it's necessary that steps to curb the influence of the virus are taken as soon as possible. Washing of hands is absolutely essential. The virus has an outer layer of lipid or fat which gets disintegrated when it comes in contact with soap. Before the authorities, who are already working at a breakneck speed, come up with a solution using medical science, let's use social science and data science to keep the virus at bay, because science is humanity's superpower.